Hello everybody, welcome to healthtools.news.com here at the considerably large booth of BUPA Care Connect and BUPA Arabia. I have the privilege to be joined by Ali Sheneamer, Chief Business Development Officer for BUPA Arabia. I'll give it right on to you, maybe a quick introduction of yourself first and about what you do at BUPA.
My name is Ali Sheneamer. I handle business development at BUPA Arabia. I've been with the company for 13 years. Business development takes care of marketing, product developments, and how do we bring these services to life and connect with our customers.
Perfect, thank you so much. Many people in healthcare and most of our audience will have heard of BUPA itself as an insurance, but can you give people a quick idea about what BUPA actually does and then connect it first to BUPA Arabia, whether that's basically your business offering in the region here?
BUPA is a global group headquartered in London. They operate today in more than 190 countries. They have more than 20 hospitals, 400 clinics, 900 dental centers. So they are heavily engaged in healthcare and health insurance. So it is an integrated model of health insurance and healthcare services at the same time. BUPA as a group is the largest shareholder of BUPA Arabia in Saudi. BUPA Arabia is a listed company here in Saudi. And last year we created our provision arm, BUPA Care Connect, which will take care of the healthcare provision to our customers, starting with digital care, through teleconsultations and all the services around teleconsultations, such as medication delivery, lab tests at home, vaccination at home, referral to hospitals, managing you when you go to the hospital. So all of this is done through BUPA Care Connect. During this quarter, we will open our first physical clinic in Riyadh. And this is one of many clinics that we will open during 2026. We expect to open another 3 clinics in 2026, 2 in Riyadh and 1 in Jeddah. And the idea is you create a portfolio of customers through digital care, and then you manage them through the physical clinics when they need to. Ideally, you don't want them to go to the physical clinics if you manage them remotely properly. And the idea is to have a full view on the journey of the customer to help improve their health outcomes, while also rationalizing their consumption of the healthcare services to what is really needed to address their issues, with more focus on chronic conditions. Chronic conditions today, although the percentage would vary between 14 to 18%, depending on the condition.
Yes.
In Saudi, however, they consume more than 52% of the healthcare cost, and this is true for private sector and public sector as well. And they tend to visit hospitals repeatedly, and they go from a place to another, from a doctor to another, just trying to find what is the best for them. Through BUPA Care Connect, we have our own doctors who have the full view on the journey of the member, to guide them where to get treated physically or to manage them remotely, reminding them of their medications, dispensing their medication before they run out of medications. If they need a lab test, they will send them someone to collect blood samples at home or at office. If they need home health care, they will send them a doctor or nurses to provide care for them at their home. And the idea is, I don't want them to deteriorate. I want to manage their conditions so they can enjoy their life, improve the quality of their life, and live healthier.
Amazing, that's a tremendous answer. Maybe zeroing in on the part of the vertical integration. So coming from Europe, but also from my experience with other international private insurance companies, health insurance companies, very rarely you find them vertically actually deeply integrated. I think the most they venture is towards digital healthcare, teleconsultation, but actually operating, as you do with BUPA Care Connect, hospitals on the ground and having your own doctors and your own nurse, your own staff, is I think a model that is not that frequent, but it seems in your case to work very well, right?
Healthcare provision is a very wide space, and you cannot cover it all.
Yes.
We look at the pain points of the member during their journey. Outpatient services account for almost 97% of the incidents.
Yes.
So most people interact with outpatient clinics more than inpatient being admitted or having surgeries. These are the rare 3% incidents that you would come across in your life.
Yes.
So outpatient services can be managed very well through digital health and through physical clinics. And we actually form partnership with other healthcare providers. We cannot do this on our own. I need to care for my customer, so I form the right partnerships to complement my offering. There are cities that I might not have a physical clinic in. I can reach them remotely, but if they need to be seen physically by a doctor, then I have a network of partners through BUPA Care Connect to attend to my patients' needs. If they need to be admitted or operated on, then I also have partners to refer them to, who is the best in cardiovascular surgeries, who is the best in brain surgeries and orthopedic, etc., etc. So these centers of excellence would provide the right service for my patient. So vertical integration can be focused on the pain point as a solution, or you can have a deeply integrated model which would require you to have a closed system, like a Kaiser Permanente in the United States. That's a closed system.
Yes,
you can only work within the Kaiser Permanente network. And today we don't have that in Saudi. However, it's an open network that is being orchestrated through BUPA Care Connect, whether digitally or physically through their own clinics or physically through their network of partners.
Perfect, thank you. I think that's a very, very interesting field and concept, and fairly comprehensive. And we will definitely give people an opportunity to connect with BUPA and with you through the channels, through email and social media, if they want to learn more about it. I would like to shift speed for a second and look at health and medical tourism. My first contact point with BUPA itself as an insurance company was when we had patients coming to Germany getting private healthcare treatment, but these patients were from the GCC, specifically a lot from Abu Dhabi and Dubai, I think, where BUPA also has a very strong presence, but also from the Kingdom. And this kind of treatment was covered by BUPA, actually, by the international health insurance. Now we see the Kingdom change, specifically Saudi Arabia used to be a large exporter of international patients. They went outside. How do you see the Kingdom develop when it comes to bringing patients from outside of the country here for medical care? And where do you see your role with BUPA or BUPA Care Connect?
My focus is my customers. We sit at a unique position, being local and international at the same time. So we have actually a local/international insurance where our patients can be treated locally or internationally. That's why we send them to Europe and the States to have treatment. But I mean, medical tourism, this would be targeting more the healthcare providers.
Yes.
I don't want to be a healthcare provider to the masses. My focus is to manage the health of my customers because I'm not in the business of being a standalone health provider. It's a totally different business. I want to manage the integration between healthcare and insurance. That's where I have strength and have expertise.
Perfect. Maybe lastly, it's the first day of Global Health Exhibition 2025 here in Riyadh, Saudi Arabia. What is your opinion and your feeling towards the first day, and what is your take on the next coming days?
It's a great event. I mean, huge number of people showed up during the first day, and I expect the same to happen next year. It's a chance to form partnerships with lots of partners within the health ecosystem. We have already signed a few agreements with a few partners, and we have more to be signed over the coming 2 days. And we participated as a platinum sponsor for this event because of its importance in actually learning what are the best practices within healthcare.
Perfect. Ali, thank you so much. I think this will be a very beneficial interview for our viewers, for the people who see it. And I hope you enjoy the rest of this event, and great success to you.
Thank you.
Thank you.